Hi everyone, welcome to this session pertaining to A to Z of pregnancy care. In this session, I shall be discussing A to Z terminology pertaining to pregnancy and pregnancy care. Again, it is in A to Z alphabetical order so that I plan to cover most of the commonly used or commonly inquired terminology related to pregnancy. Starting with alphabet A I've considered to represent antepartum period. Ante refers to before and partum is birth. The time period before the baby's birth is the antepartum period, and this usually comprises, the duration of pregnancy, 280 days or 40 weeks or 9 calendar months or 10 lunar months. Coming to the next entry or B or breastfeeding, as you all know that breastfeeding is extremely important after the baby's birth, and in fact the breast milk, it contains all the nutrients and it is sufficient as a whole soul meal exclusively on its own. It is beneficial for the baby for the first 6 months, so you do not have to give any kind of top feeds to the baby, and this itself, it suffices, the breast milk. Also, breast milk is a very rich source of immunoglobulins, so it protects the baby against various kinds of diseases and various kinds of disorders. So breastfeeding also promotes a bond between the mother and the baby. Breastfeeding is equally beneficial for the mother as well as the baby, so it must definitely be initiated. And a pregnant woman during her antenatal period itself must make up her mind that she is going to breastfeed the baby as soon as possible after birth. Coming to entry C or C, it stands for cesarean birth. So as you all know that in cesarean surgery, an incision is given over the uterine cavity to deliver the baby after 28 weeks of pregnancy. And since this is a major surgery, because this involves opening of various abdominal layers, so the woman, once she's undergone a cesarean delivery, she becomes a high risk in all her subsequent pregnancies. So I highly discourage cesarean delivery unless it is done to save the life of the mother or the baby. That means there is some maternal or fetal indication for cesarean delivery. Otherwise, cesarean section on maternal request or cesarean section because I'm scared of natural childbirth, I normally do not recommend. Coming to entry D or DFMC, which is daily fetal movement count. So again, I have lots of patients saying that, the baby is not moving, or the baby has not moved over the past few hours, or the baby's movement I felt were little, so I'm worried and I don't know if the baby is fine or not. So DFMC helps deal with all this. So in this, what the women should do every day, preferably at the same time. And this time she needs to choose where she's going to be mentally free from all the other tensions which are going on with her life, and she can just concentrate on baby's movements. She should choose a time like that, and during this time she should lie on her left side and then she should concentrate towards counting the fetal movements. So whenever she experiences a fetal movement, she should note it down, and if she is able to experience about 10 fetal movements in an hour, her baby is completely fine. And if she cannot experience 10 fetal movement within an hour, then she can count for another hour. So if within 2 hours she is able to have 10 fetal movements, it's absolutely fine. The baby is doing fine. If within 2 hours also she cannot experience 10 fetal movements, it is possible that the baby is sleeping, or baby is hungry, or baby is simply not in the mood. Baby doesn't want to move. End of the story. So what you can do now is, after 2 hours, if you have less than 10 movements, you can just simply take a walk, move around your house, or you can drink some orange juice, or you can play some music. So, or maybe play a bell around your belly so that the baby can hear the ringing sound. Because the voice stimulation is likely to arouse the fetus and provoke it to start moving. So you can do these activities and then again start counting the fetal movements. If still within 2 hours you feel 6 fetal movements, then you can consult your doctor and you can take the doctor's advice, because the doctor will do further tests to determine if the baby is fine or not. It doesn't mean that the baby is compromised just because you felt 6 fetal movements or less in 2 hours, but the doctor will take further steps to ensure that the baby is fine. So coming to the next alphabet, or E. E is EDD, or the expected due date, expected date of delivery. So all of you who are pregnant or who are in their advanced pregnancies, they would know that your EDD, or the expected date of delivery. Expected date of delivery is usually calculated from LMP, which is the last menstrual period. So you add 7 days to the date of your last menstrual period and then you count forwards 9 months. That gives you the expected date of delivery. Coming to F, the entry F I've chosen is folic acid. Why folic acid? Because folic acid is a very important vitamin supplement which the woman needs to take not only during her first trimester but also during her preconceptional period. So the women who are planning their pregnancies and they have yet not conceived, they need to start taking folic acid in the dose of 500 micrograms per day. This is so because folic acid will help prevent the neural tube defects. So what are neural tube defects? Neural tube defects are basically defects which could be involving the neural tube, which results in the formation of either the baby's brain or the baby's spinal cord. So there could be a condition known as anencephaly, where the baby's brain has not developed properly, or there could be conditions such as spina bifida, where there may be defects in the baby's spinal cord. So all these horrendous things can be prevented if you take folic acid. In fact, during the first trimester, the only medicine or the only supplement which the woman needs to take is folic acid. There is no need to take iron or calcium in the first trimester. This you can start taking from the second trimester onwards. First trimester because organogenesis is taking place and because the woman may be having nausea, vomiting, and she may not be able to take in a lot of things. So coming to the next entry, which is G. So G stands for gestational diabetes, or the diabetes which makes its appearance for the first time during pregnancy. So previously the woman was doing fine, but during her pregnancy she developed gestational diabetes, or she developed just diabetes, and this diabetes is usually the type 2 diabetes where there is an associated insulin resistance. That means the body is resistant to the action of insulin, and as a result the blood sugar levels, they rise and she develops gestational diabetes. Now the main problem why I've considered this entry here is that gestational diabetes, if it does occur, it can result in several complications for the mother as well as the baby. And the most important complication which it can give rise to in the long term for the mother is that she may develop, maybe after another 10, 20 years, she may develop type 2 diabetes. Also, the babies born to such mothers, when they are in their childhood, they may develop childhood obesity, and subsequently later in life, they're also prone to develop type 2 diabetes. So gestational diabetes can have long-term consequences. And the good thing is that if you observe certain lifestyle precautions, and if you are able to control your blood glucose levels so that you do not have symptoms of gestational diabetes. So gestational diabetes, being a lifestyle disease, is completely preventable, and you need to take certain precautions in your diet and you need to take certain precautions in your lifestyle to be able to control this. In case you are more interested to know about gestational diabetes and how to prevent it, then I am having this workshop between 6th, 7th, 8th May. It is an online workshop which is having 5 sessions, and the combined time duration is about 10 hours. It is on Friday, Saturday, Sunday. So if you are interested, you can join this workshop, and for this you can WhatsApp me You can WhatsApp me on my number 7042535604. So the next entry, FGH. H is standing for hypothyroidism. Again, thyroid dysfunction, very common in women, in pregnant women. Again, hypothyroidism is itself a very common cause of infertility and why the women may not be able to conceive early. Hypothyroidism could be one of the causes. Also, hypothyroidism is associated with miscarriages, and if the woman does become pregnant, it may be associated complications like anemia, there might be gestational hypertension, there might be abruptio placenta, there might be preterm births, and so on. So it is important that you keep monitoring your TSH levels during your pregnancy in case you are hypothyroid prior to pregnancy. So it is important to monitor the TSH levels, and based on that, the dose of eltroxin or thyronorm which you are taking needs to be monitored. So the next entry, HI, iron deficiency anemia. So iron deficiency anemia, again a very important cause of anemia. In fact, one of the most important causes of anemia in pregnancy, especially in India. And it's again a very preventable thing if you take proper precautions in your diet. You take simple precautions like cooking your food in iron vessels, taking the iron tablets with milk, simple precautions like that. If you take certain simple precautions, you can very well overcome this problem. And again, this is another topic which I would be addressing in my workshop, which occurs between 6th, 7th, and 8th of May. So please do attend in case you want more information. And IJ. So the next entry is J, which is jaundice in the newborn. Jaundice in newborn, again due to physiological causes, very common. Because physiological, why? Because the baby's liver may not be mature enough to deal with the bilirubin, and as a result the bilirubin levels, they rise, resulting in jaundice. So what's the way out? You tell the mother, need not worry at all, you just expose the baby to sunlight. You can take the baby out for walk in the sunshine, or you can sit with your baby in under sunlight. That will take care of physiological jaundice, because anyway it will disappear within a day or two. So the next entry is K. So K stands for Kegel exercises. Kegel exercises, they basically help in strengthening the pelvic floor muscles, and this helps in the process of natural childbirth. And if the Kegel exercises are done by the mother during the antenatal period regularly, then it can also help prevent the administration of episiotomy, a cut which is given in the perineum at the time of childbirth. So if she's been doing Kegel exercises timely, this will prevent that. And also it helps the women in the postpartum recovery. So during the postnatal period, the various complications which she might be suffering from, incontinence, etc., all this will be taken care of, and the healing is promoted of the perineal region in case she does Kegel exercises. So I advise the women to keep doing Kegel exercise throughout their lifespan, because it helps in preventing complications such as urogenital prolapse, incontinence, etc. later in life. The next entry, L, lochia. Lochia is nothing but basically discharge which occurs in women who have given birth to their child. So lochia, it persists for about 2-3 weeks following childbirth, and initially it may be red in color, then it may turn brown or pinkish, and eventually it turns white or yellow in color. So why is this important? If there is excessive discharge, especially which is foul smelling, or if it is associated with abdominal pain, cramps, or there's an excessive bleeding which the woman thinks is also occurring with the lochia, then she must consult her doctor, because probably there might be some underlying uterine infection which has occurred following the baby's birth, or maybe the uterine involution after the baby's birth is not occurring properly. So these conditions would also be dealt with. So M, morning sickness. Morning sickness, basically a very common problem. And then again, if you consider certain lifestyle precautions and certain lifestyle changes, you can very well deal with the nausea and vomiting which occurs during the first trimester. Again, I advise women not to worry about their calorie intake or about their nutrition during the first trimester, and just focus on what they are able to take and they are what able to keep inside. So they just can eat whatever they feel like eating and whatever they are not able to vomit out. They should not worry about the calories and nutrition during this period. The next entry, N, or the NST. NST stands for the non-stress test. So this is again done if what we discussed previously, the DFMC is coming out abnormal, that is she's feeling less than 6 fetal movements in 2 hours, then she can consult a doctor, and in that case the doctor may do a test which is known as NST. In this, she has to do nothing but just count the fetal movements again, lying on her side. And the only additional thing which is done in this case is a cardiothoracy machine which monitors the baby's heart rate will also be attached. The belt of this machine will be attached to the mother's abdomen so that the fetal heartbeat will be monitored through this device. And in case, how the doctor observes it is that if there are accelerations or the fetal heart rate rises whenever mother experiences some fetal movements, that means the baby inside is doing fine. So even if there are fewer fetal movements but there's a increase in the heart rate which is occurring with these fetal movements, then probably the baby is doing fine, and this is the basis of the NST or the non-stress test. So next entry, O, or obstetrician. So obstetrician, again, as you all know, is a doctor who deals with delivering the baby and the care during the antenatal and intrapartum as well as the postnatal period. Many countries, instead of the doctor, it is the midwife who is involved in all these tasks, but in India it is mainly the doctor who is responsible for all these things. P, the preterm and the postterm pregnancy. Again, the reason for considering these terminology is that many women, they are worried, I've delivered at 36 weeks, is my baby preterm? Or I'm not even having contractions, I'm 40 weeks now, is it normal? So, or is it postterm? So I would like to tell you, if the delivery occurs prior to 37 weeks, it is preterm birth. If it occurs more than 42 weeks, 294 days, so above 280 days, also 2 weeks more, we keep it as a grace period. So if even after 294 days, the woman doesn't deliver or she doesn't have labor pains or signs of labor, then she's considered as postterm. So next entry, Q, I've considered the entry for Q as quickening. Quickening refers to feeling the fetal movements. Again, a very common complaint, and a lot of women, they come to me that, it's been now 3 months. My friend felt the fetal movements at 3 months. I'm not being able to feel it. My baby is not growing probably. So the fetal movements, normally a multigravida will be able to experience at about 16 to 18 weeks, and it's in form of some kicks or some fluttering sound of the movement of the baby's limbs. So that is how you will experience it, and it is usually experienced between 16 to 18 weeks in multigravida. Multigravida, or the women who have given birth previously, they experience these fetal movements at an earlier period of gestation in comparison to primigravida. Primigravida are women who are giving birth for the first time. So since they are not so experienced, they might feel these fetal movements slightly later. So we keep a grace period of about 2 weeks. So about 18 to 20 weeks is the time when a primigravida normally would experience fetal movements. So I've considered RH negative pregnancy. Again, RH negative, why? Because I'd like to tell you a little about the blood groups. The blood groups, they are basically two classification systems which is followed. The one is ABO system, the other is the RH system. So as per the ABO system, The blood group can be A, AB, B, O. Then there's another classification system, the RH system. So it could be RH positive or RH negative. So if your blood group is A positive, means you are blood group A as per the ABO system, and positive means you are RH antigen positive, or as per the RH classification system you are positive. And if you are RH negative, if suppose you are A negative, that means as per the ABO system you are blood group A, but you are RH negative. So why is this important? Because when you go for your first antenatal visits, obviously your blood grouping would be done. And why this is important is because if the mother is RH negative and the father is RH positive, then in that case there are chances that the baby is RH positive. So if the baby is RH positive, this baby may induce the formation of some kind of antibodies in the mother who is RH negative, and these antibodies, they may attack the baby's red blood cells, resulting in complications such as hemolytic anemia and so on. So to prevent this, we give RH immunoglobulins or the antibodies to the mother during her 28th week of pregnancy, so that these immunoglobulins, they prevent the development of these antibodies which can destroy the fetal cells. So if the mother is RH negative, nothing to worry about. She needs to be more careful and she needs to get the injections of these immunoglobulins at regular intervals. So coming to entry S or stria gravidarum. So stria gravidarum refers to the occurrence of the stretch marks. So stretch marks, again, it's a very common problem occurring in pregnancy. They can develop over abdomen, over thighs, over chest. And if you have sudden new appearance of stretch marks, it's best to consult a doctor. They'll give you some topical creams which you can apply to prevent their further progression or even to dissolve those stretch marks which are appearing. Besides that, what you can do in your diet is you can take foods which are rich in vitamin C, D, E, take plenty of water, bring your weight under control. If your BMI is controlled, then the occurrence of stretch marks is likely to be much lesser. Another home remedy which can be done is application of coconut oil. While you are pregnant, before the appearance of stretch marks, you can apply coconut oil on your belly and on the thighs and on the chest every day. This is likely to prevent the development of stretch marks. So no harm in trying this method because it is so natural. So coming to the next entry, which is T. So T stands for tightening. Tightening refers to uterine contractions. Ideally, from the very beginning of pregnancy, the woman starts experiencing uterine contractions, and initially, when the woman is just conceived, these contractions are painless and they are termed as Braxton Hicks contractions. And as the pregnancy it increases in duration, these contractions, they may become, towards the beginning of labor, they may become very painful and strong, and they kind of announce the onset of labor, because when the woman starts having painful uterine contractions along with the rupture of membranes and the appearance of a bloody show, that is the time when we say that the woman has gone into labor. So next entry, U. U for ultrasound. Ultrasound is the safest imaging investigation which can be done in pregnancy. X-rays, a complete no-no. CT scan, no. MRI, if it is really required, then you can go ahead with an MRI. Ultrasound, considerably safer. But again, recent studies have shown that too much ultrasound examination may result in defects such as thermal effects. It may result in cavitation defects in the tissues. So it should be avoided. So ultrasound in the first trimester, one ultrasound examination for dating, because that is the most accurate ultrasound examination for dating a pregnancy. In the second trimester, for anomaly scan and ultrasound scan can be done. Third trimester, if the doctor feels maybe because the baby is not growing well, you want to monitor the growth of the baby, or you want to see the fetal presentation In those cases, you may go ahead with an ultrasound. Otherwise, not required. V for vaccines. The most important vaccine which needs to be administered during pregnancy is tetanus toxoid. Again, the first dose to be administered anywhere between 16 to 24 weeks, and the second dose after 4 to 6 weeks of the first dose needs to be administered. And you need to be careful that the second dose should be at least 2 weeks prior to the expected date of delivery. And other vaccines which can be administered, keeping in mind that today's scenario, COVID-19 vaccination absolutely safe, and you must go ahead, get this vaccine. If it has not been given to you, get this vaccine for sure, because this is going to protect you as well as your baby. Because if the COVID infection does occur in pregnancy, then the chances of it being more severe are more if the woman is pregnant. So this will help you prevent, or this vaccine will prevent you from the severe COVID-19 infection, which can even at times be fatal. So you need to be protected from that. So the next entry is W, or W stands for walking epidural. So walking epidural analgesia, you all know, is given. Epidural basically refers to the injection of painkillers as well as sedatives, which is administered through the spine, and this helps in making the lower part of the body, waist downwards, numb, so the woman does not feel pain during her labor. Nowadays, there's a concept of walking epidural, because previously what was happening was the epidural caused numbness of the legs, and so the woman was unable to walk around during labor. But now they have introduced this concept of walking epidural, wherein the dose of medication which is administered is much less, so the limbs, they do not become numb, and she can still have some mobility during pregnancy. So being mobile during your labor is likely to help the process of natural childbirth, so it is promoted. X stands for X chromosomes. Again, why X chromosomes are important? Because women, they have two X chromosomes, and men, they have one X chromosome and one Y chromosome. When the baby is born, the baby will get one sex chromosome from each of the parent. So from the mother, the baby can get only X chromosome. Now, if the second chromosome which they get from the father is an X chromosome, then the baby would be a female child. But if the baby gets a Y chromosome from the father, then the composition would be XY and the baby would be a male. So male and female sex of the baby is decided based on whether they get X or the Y chromosome from their father. So it is basically the father's sex chromosomes which determine the sex of the baby. So Y. Y stands for yeast infection. So yeast infection is basically commonly due to candidal infection, and candidal infection is common in pregnancy because of the hormonal changes which are taking place during pregnancy. So again, to deal with candidal infection, it is important to take care of your vaginal health during pregnancy, to maintain hygiene, to maintain hygienic habits, to maintain cleanliness, not to use strong deodorants or perfume. Take steps to maintain the vaginal health. In case you do develop vaginal infection, then you can consult your doctor, and it is better to take topical creams or suppositories rather than taking oral tablets, because they can be harmful to your baby. Talking about the last entry, or Z. Z stands for zygote, and zygote is considered as the beginning of life. It is an irony that we are considering it as a last entry, but Z, the zygote, is the beginning of life, because zygote is formed after fertilization of the male sperm with the ovum. And when the zygote divides into multiple cells, eventually the fetus and the entire fetal organs and everything is formed. So this is serving as the basis of life. So that was all for today's session. And in case you are interested in knowing more about gestational diabetes or iron deficiency anemia, or how to deal with common pregnancy related problems, then you are more than welcome to attend my workshop. And for that, you can easily contact me on my WhatsApp number, and I'll be happy to share the details with you. Also, you can find the details of the various ways how you can contact me in the description of this video, so you can go through. And please don't forget to subscribe and like this video. Subscribe to my channel so that more videos are uploaded, you'll be able to get the notification for that. So thank you so much for watching this video.